Good morning. I want to congratulate Dr. Maria Fernandez to have thought about this program and have all the experts here to talk about what the trauma care in Latin America should be and should take place and how it should take place. Now, I'm not an epidemiologist, and really I'm not the right person to talk about this, so I'll try to do the best I can. So as we all know, trauma has become a global epidemic, and you can see the numbers of people that get injured with a very high mortality rate, accounting for a large number of the world's deaths, and 90% of the fatalities occur in lower and middle income countries, and this is actually increasing dramatically. The biggest problem is the road traffic injuries, a huge public health and development problem. You can see 1.2 million deaths a year, more are disabled, and 23% of all injury deaths occur, and 2.1% of all deaths globally. So enormous amount of global burden of disease because of road traffic injuries or incidents. We really should not be calling them accidents anymore. And this is the WHO report in 2004 showing the various road traffic fatalities in different countries. And you can see that the stats in Latin American countries is actually increasing, whereas the more developed countries are actually trying to decrease it. And the number of dailies lost, according to the world rankings of injury-related mortality and burden of disease, and if you look at the numbers from 1990 and compare it with 2020 that they're projecting, you can see that this is actually dramatically increasing. So it's going to be much worse as we keep going forwards. So this is one of the things that we need to keep in mind. That is a comment made in the American College of Surgeons, Resources for the Optimal Care of the Injured Patient, that the needs of all injured patients are addressed wherever they are injured and wherever they receive care. And you can see that the few individual facilities can provide all the resources to all the patients in every situation. In other words, you cannot get to a trauma center every time you have a crash. So you need to have a very good development of a trauma system of care. It is not enough to just have multiple hospitals, term them as trauma centers, and expect them to treat the injured patient efficiently. And there are very good data, and Dr. McKenzie has done a lot of work with this to show that the establishment of a trauma system is very helpful. And you can really make a big impact on that preventable mortality that happens when the patient is not appropriately treated, and we make lots of mistakes, and the patient sustains a mortality. And in fact, we looked at our own data, and we actually found out that even though we were a very established, well-seasoned trauma center, we established that 10% of our trauma deaths are preventable. And that's a staggering number of deaths. And if you look at the causes of these preventable deaths, it is all in the very basic things like the A, B, and C. So inadequate control of airway, breathing, and circulation that cause majority of these mortalities. So what can we do about this? I think we need to have a trauma systems based on a very good assessment of what the needs of the patients or the populations are, what exactly are the resources they need, what kind of public support they can get, and finally, we need to have, to make all this possible, appropriate leadership. We need to have legislative support at the highest levels, and we need to find planning and development and try to fund it. And this is how a robust trauma system should work. There is an active interplay between all these various components with leadership, legislation, financing, and have the legal authority to actually take action to correct some of the improper things that are going on You want to designate your trauma centers. You want to constantly verify them periodically so that they can maintain that level of quality. And then you should also evaluate your systems and make sure that they're all working properly. And you go back and take these lessons and establish training programs, quality improvement programs, and quality certification. So this is what we try to do in the United States, and I think we do that reasonably well. And this is not that something that the Latin American countries have yet become mature in, and I certainly think that this is an important agenda for the future. Now, in Latin America, unfortunately, the trauma care is much more complex, and there's so much variability between the types of injuries you see, the types of patients you see, and within the countries and within different countries, it's extremely variable, so that you cannot come with one system or one answer that fits all. So you need to have multiple answers or multiple programs based on a common theme. And there is tremendous economic stress. There is variations in healthcare spending, variations in the private and the public hospital mix. Most importantly, you don't have accurate data. And I'll show you some data where my partner, Dr. Abutanos, went to Ecuador, and actually what he was told, what their trauma mechanisms were, absolutely wrong. And when he actually looked at, on a registry-based collected data, looked at what the mechanisms of injury are, they are a totally different picture. So you need to have accurate data so that you can define the problem and then try to come up with some interventions. And most importantly, there is a lack of public support at the highest levels in legislative circles as well as the public. And when I go to India, for instance, as my home country, they just take trauma for granted. They say it happens. There's nothing we can do about it. So that kind of a lack of public knowledge and public support is a serious impediment. So that should be on your agenda. So we need to do some research, look at what the pre-hospital problems are, what are the trauma hospitals are doing, and how well they are doing, and what happens to the patient after they get out of these trauma hospitals. Interesting study in urban Latin America. This was done in Monterrey, Mexico, and they looked at all the various phases of mortalities. And look, most of the pre-hospital deaths occur before the patients even get to the hospital. And then a good number of patients actually die within the emergency department. So you're really talking about the first 1 hour of trauma, the so-called golden hour, where we are not able to give them the appropriate treatment. So you need to have interventions in the pre-hospital period by appropriate injury prevention, violence prevention, establishment of good pre-hospital protocols, developing your EMS systems. And then you want to take this on to the emergency department, make sure all the physicians and all the personnel are adequately educated and trained, and they have all the facilities that they require. Continuing medical education is a very important part of our practice. If you want to take care of injured patients well, you have to maintain this continuous medical education in ATLS, in pre-hospital trauma life support, advanced cardiac life support, etc. These are some of the data from our own institution where we actually participate in advanced trauma life support, either by face-to-face or by distant education. And these numbers now actually are way up. So this kind of a continued medical education is, you have to make the commitment and make sure that it happens. Sorry. Okay. So this is why the World Health Organization, along with the International Association of Trauma Surgical Intensive Care, which is called the IATSIC, looked at all these data and showed that there should be emphasis towards inexpensive improvements in the pre-hospital and facility-based trauma care. They came up with these essential guidelines, which are very basic things that you can make tremendous difference by having these in the emergency departments. And they classified this as human resources, physical resources, administration, organization. And they call these the rights of the injured patients. And so if you look at these are very basic things, all about A, B, and C. airway, breathing, control bleeding, consequences of traumatic brain injury by taking good care, not getting hypoxic or hypotensive, promptly recognize abdominal trauma, correct all the other extremities that can cause severe disability like the extremity fractures, etc., and make sure that the patients need basic pain management so that they don't suffer. So these are really the rights of the injured patients. So this is the essential trauma care guidelines, as they called it, and they put it out there, and then more and more centers are beginning to recognize that these are things that you can easily do. And Dr. Ivatury actually looked at this in 2010 and went to Ecuador, looked at 7 provinces, urban and rural, 24 facilities, and looked at what their facilities are in terms of satisfying these essential requirements. And these provide a very simple and useful template to assess trauma care capability. And he pointed out that you really can do this. It should be done. And their recommendation from this paper is that you really should take these essential trauma care guidelines, take it from your societies, in your own countries, and make sure that all your establishments, all your institutions carry out these essential trauma care guidelines. And I think an important step is taken by Dr. Coimbra and Dr. Fraga with their leadership. They got together the entire trauma community from several different countries, and in a World Trauma Congress that happened in August of 2012 in Rio. It was an outstanding meeting where all these groups got together and talked about what the priority should be for our agenda for trauma care. And very importantly, they have made the conclusion that let's not make another society. Let's just get together as a group that is not confined by constitution or rigid guidelines, but have good communication so that we can establish what the agenda for trauma care should be. So I think with these advances, the trauma care should be having a new dawn, and I'm very hopeful about it, as long as we have a proper agenda based on cooperation, respect, mutual understanding, and lots of communication. Thank you very much for your attention.